Hi students, today let me talk about renal function test. Okay, very important short notes. Actually, I have divided into three portions of this renal function test. This is the first part. Second and third part will be discussed later. So first part of this, first subtitle for this renal function test is functions of kidneys, right? You know all the functions. I am giving one mnemonic, that is all the rape cases will be dealt in FM department, forensic medicine department. So I am simply taken FM rape like that. All these words are very important. You all know very well about this. Number one, F, that is filtration. Totally 180 liters will be filtered by our kidney per day. Second one is maintenance, very important function. Maintenance of acid-base balance, electrolytes, water, everything will be by kidney. Third one is R, reabsorption. 99% of the filtration done by kidneys, right? 180 liters per day excreted. In this 180 liters, they will reabsorbed 99%, right? Third one is R, reabsorption, and A, activation. You know the vitamin D, which is activated in two organs. One is liver, another one is kidney. So activation of vitamin D occurs in kidney. Then P, that is production. Production of erythropoietin is by kidney only. The last one is excretion. Mainly for hydrogen ions to maintain the acid-base balance. So these are all the functions of kidneys. You all know in your school days, you just recollect it. Second one is, how will you classify renal function test? I am giving just three subtitles. One is regarding the kidney parts, another one is the estimation of complete urine analysis, third one is estimation of urea, creatinine, protein and electrolytes. These three are the main titles. In these three, again I am dividing into, one is glomerular markers, another one is tubular function test. Because in your university question, the university examination, the questions will be like this only. Markers of the glomerular function test, tubular function test, like that only they will be sometimes asked. That is why I am again dividing into markers of the glomerulus, tubular function test, two classifications. For these glomerular markers, first you have to mention about clearance test, because this is the test for the GFR, glomerular filtration rate. Second one is markers of glomerular permeability. Clearance test means we have three clearance tests, that is creatinine, urea and inulin. Today I am going to discuss about the creatinine only, but we have three clearance tests: creatinine, urea, inulin. Third one is markers of glomerular permeability, how the membranes will excrete or reabsorb or fails to reabsorb. That is called excretion of protein in urine, proteinuria. That indicates the diabetic nephropathy and includes microalbuminuria. Right, these are all the conditions coming under markers of glomerular permeability. Next one is estimated GFR, eGFR. Nowadays they are using eGFR only. And we have a new novel marker, cystatin C, that is also coming under glomerular marker. Right, this is the outline for glomerular marker. Coming to the tubular function test, the idea is concentration test we are going to do, dilution test and acidification test. So how will you do these three tests and how will you find out the results? Either acidification occurs or diluted urine or concentrated urine. In which conditions you will get diluted urine, in which conditions you will get concentrated urine, like that. The tubular function test will assess the kidney function test. Next one is, before going to the renal function test, you should know about these three important points. What is the normal GFR value? 120 to 125 ml per minute. What is the tubular maximum of glucose, TM glucose? That is 350 to 375 milligram per minute. Third one is, what is the renal threshold for some substances I am giving only two, glucose and ketone bodies. Glucose 180, whereas ketone body is 3 milligram per deciliter. That means renal threshold means after 180 milligram only it will get excreted by urine, glucose. After 3 milligram per deciliter only in the blood, they will get excreted in urine, that is ketonuria, like that. So these three words are very, very important to describe about your renal function test. Next one is, how will you estimate the GFR? GFR means it provides a useful index of the status of the functioning glomeruli, that is nephron activity. So renal clearance test means performed to determine the GFR. So we have clearance test, which is the first point or subtitle for the measurement of renal function test, or GFR. Okay. Yes. Next, what do you mean by clearance? I already told you clearance means it is a test for glomerular filtration rate. So how will you define clearance? Yeah, that is volume of plasma in ml. It is defined as volume of plasma in ml, milliliter, contains the amount of particular compound. That is, volume of plasma contain the amount of particular substance which is excreted by kidney in urine within 1 minute. Right? This is the way you have to define what is the meaning of clearance. A volume of plasma defined as, clearance defined as volume of plasma in ml contains the amount of particular substance which is excreted by kidney in the urine in 1 minute. Okay. What is the formula for this clearance? We have one formula, that is C is equal to UV per P. Here you have to explain one by one what is the meaning of CUVP. C means that is renal clearance, ml per minute. Whereas U means concentration of the substance in urine, milligram per deciliter. V means volume of urine produced by per minute in ml, ml per minute. Last one is plasma concentration of the substance in plasma, again milligram per 100 ml. So with this renal clearance formula, we are going to apply it in the creatinine clearance formula also, the same U V bar P. I am going to apply just the normal levels of urinary plasma and volume of urine levels. For example, urinary concentration is 80, whereas volume of urine 1.25 ml per minute, whereas plasma concentration is 1 milligram per dl. Finally, they will come to the conclusion of the normal value of creatinine clearance value. That is why I am giving two values. Before describing the renal function test, you should know about the normal value of serum creatinine and blood urea. Serum creatinine is 0.7 to 1.2 milligram per deciliter, whereas blood urea is 20 to 40 milligram per deciliter. In some books, they have suggested uric acid is also, that is 3 to 7 milligram per deciliter. Along these three, that is urea, uric acid, serum creatinine, you have to mention about the creatinine clearance value for this renal function test. So here, for males, it is 100 to 120 ml per minute, whereas for females, 90 to 110 ml per minute. This is creatinine clearance value. Okay. After that, we are having three clearance tests, that is urea, creatinine, inulin. In these three, creatinine clearance is the best method we are following. Why? Because creatinine is not affected by any exercise or strenuous exercise or any diet. So the level will not be affected. Second one is production of creatinine is continuous. In our body, it will be continuously producing creatinine. So at any time you can collect the blood for the estimation of creatinine. There is no external factors interference. For urea and inulin, external factors always disturbing the urea concentration or inulin concentration, so that the level will be get affected. Whereas in creatinine, there will be no external factors interference. Last one is conversion of creatine phosphate to creatinine is always spontaneous. That is non-enzymatic. There is no need of enzymes. That is another advantage for the selection of the creatinine clearance test. Okay. How will you interpret it? With this value, usually the value is already I told 100 to 120 for males and 90 to 120 for females. If the value is decreased, that indicates your kidney function will be lost. Less than 75% of functions, kidney function only reflecting some other renal diseases like chronic kidney disease, acute kidney infection, and heart failure. Sometimes blood flow to the heart also will affect the renal function test. So interpretation means the only level is decreasing level, which will always go for the acute kidney disease and chronic kidney disease. Acute kidney injury, not disease. Acute kidney injury and chronic kidney diseases, and also heart failure. So these are all the interpretation points for creatinine clearance. Okay.